This afternoon, we wrap up our Black History Month interview series focusing on racial disparities in health and conditions that disproportionately affect the Black community. And today's topic is HIV/AIDS. And joining me are Chief Medical Officer Dr. Sebastian Ruhs and Outreach Coordinator Jahi Omari, both from Chase Brexton Healthcare. Thank you so much for coming in this afternoon to talk about this very important topic. First, let's go over some statistics that you all shared with us. Black individuals make up 61.6% of Baltimore City, but accounted for 84% of new HIV diagnoses in 2021. 773 cases of HIV diagnosed in Maryland in 2021. 71.9% were among non-Hispanic Black people, 11.8% among non-Hispanic white people, 13.1% among Hispanic people, and 3.2% among non-Hispanic other people. Statewide, the rate of Black individuals living with HIV is 3 to 10 times higher than the rate among non-Hispanic white or Hispanic individuals. Now, that's a pretty significant difference. Dr. Ruhs, can you talk about that a little bit? First of all, though, I want to touch on, a lot of folks don't realize how much HIV and AIDS is still a problem.
It is, yeah.
Yes.
The pandemic has really drawn the attention elsewhere, but HIV/AIDS is still a problem, even though nationwide numbers have declined over the last couple of years. But why are African Americans more affected? And I kind of want to start off by clarifying HIV does not discriminate. HIV can affect anybody, independent from age, race, gender, ethnicity. However, it's important to when trying to understand why African Americans are more affected to talk about the social determinants of health in this context. Really need to understand that those are negatively impacted by social barriers that have been created as a result of institutionalized racism. And as a result of that, there have been inequities created in our society that negatively impact African Americans predominantly. And when it comes to HIV/AIDS, makes it more likely for these communities to get in contact with HIV and makes it less likely for them to be diagnosed early and treated early.
Does poverty have something to do with that?
Absolutely, yeah. That's one of the components of it. And poverty leads to many other problems, right? If we're just looking at what specific inequities we're talking about, we can talk about geographic inequities, right? African American communities are less likely to be located close to organizations that offer healthcare. So a delay in testing and a delay in treatment. It can be financial inequities, poverty, with more of a fear of copays that may come out of seeking care in the healthcare system, or even going further, inequities with having limited access to health insurance.
Right, right. Jahi, tell me about your outreach and what you can do about it and how you're reaching an at-risk population.
Yeah, so our goals are mainly increasing access to HIV prevention care and HIV medical care. For HIV prevention care, we do a lot of outreach and try to do testing in the community and at our sites. So we do HIV rapid testing where you get results within a few minutes. And during the rapid test, we try to have candid conversations about how they can reduce their risk of getting HIV, like using condoms, doing routine testing, like knowing your partner's status and things like that. We also try to really promote PrEP and PEP. PrEP is a medication you take before you have HIV. And if you take PrEP consistently, then you won't get HIV.
Then you can protect yourself.
Protect yourself. And there's also PEP, which you take it after a potential exposure, but you have to take it within 72 hours of the exposure to make sure it works. And for individuals who do have HIV, we do a lot of case management services, get them connected to their doctor as soon as possible, and address all their barriers.
Because it is such a treatable disease now, correct? You just have to be able to diagnose it and handle it, for sure. Yeah.
Absolutely.
Yeah.
Diagnosing is the key. Medication nowadays can really expand life to a normal life expectancy.
Yeah.
It's a very, very well treatable disease.
Absolutely, and it's such a shame if it doesn't happen because someone doesn't get the treatment
Correct,
that
yeah.
they need.
Yeah.
Well, thank you both so much for coming in.
Thank you.
Really appreciate you educating us about this.
Thanks a lot.